Great. So now that's started, just wanted to welcome everyone today and thank you for taking the time out to join us. I'll just introduce myself. I'm May. I'm Insight and Impact Manager here at Starlight. So on the Insights and Impact team, we evaluate Starlight services. We conduct research into the benefits in health play. And we also generate lots of knowledge and learning that we can use to support children to play in healthcare. And just to introduce the other two people who you'll see and hear from today. So Sandy's with us as well, she is the one controlling the slides. She's our head of Insights and Impact. And so she leads our team in all of our research and evaluation work. And then we've also got Kev here, who's head of partnerships and philanthropy. So he leads all of the high value fundraising activities. So things like applying to trusts and foundations and working with corporate supporters to fundraise as well. So you'll hear from both of them. We're going to kind of rotate among the three of us. And next slide, please. Thank you. So yeah, as you guys know, we're going to talk today about Starlight's new award, which is called the Health Play Innovation Award. We've got about a 20 or 25-minute presentation where we'll talk through what a health play innovation is, some information about applications, so how you can apply and what the process is, and also then move on to judging and celebration, so how we'll celebrate the winners of this award. And then we'll have about hopefully about half an hour, 25 minutes, the rest of the time for questions from you if we haven't been clear about anything or you'd like to just ask a question about anything. And then we'll be closing at 1:30 today. So as we go through, if you have any questions, please just pop them in the chat and Sandy will be monitoring it and we can come to them at the end. Or when we get to the end, if you fancy and you want to come off mute, we've got quite a small group today. So if you'd like to ask your question yourself, then that's also completely fine. But yeah, if there are any questions throughout, just pop them in the chat and we'll come to them at the end. So this is really just to set the scene before I pass over to Sandy for the first section. Today, we're going to be talking about innovation in health play. And so from Starlight's work, we work a lot with many different healthcare settings across the country, and we've built relationships with various healthcare professionals. And so we've heard quite a lot about how healthcare professionals can be really inventive and creative in the way that they deliver play to children in healthcare. And quite often, health professionals have noticed a kind of problem or a challenge in their setting, and they've kind of come up with an innovative solution to address that challenge. And so this Health Play Innovation Award is really there to recognise and celebrate these innovative projects. For these applications, we'll kind of want to hear from you if you've delivered an innovation in health play and if you can provide some evidence to show that it's had an impact in your setting. So that's the kind of general gist of today's webinar, but we're going to go into a lot more detail about what we mean by all of those things. So I'm going to pass to Sandy for the first section on what we mean by a health play innovation.
Thank you, May. And so if you were wondering what we mean by health play innovation, I will be speaking to you for the next few minutes about that. If you look at different organizations and people who work in innovation, they might have different ways of defining what innovation is, but most of them kind of say the same things, which is about having a new or novel or different way of addressing a problem or an issue and a challenge in their organization or in your life. And essentially, that's what we're trying to celebrate. If we drill down a little bit more and look at what innovation actually is and what it involves, a lot of the literature kind of breaks it down into three main bits. One is about defining what a problem is. Then the second stage of that is then identifying the solution to that specific problem. And then it's about testing that idea out and making sure that it's working and it's actually doing what you set out to do in the first place. So in the context of this award and what we mean by health play innovation, we're looking at health play interventions or solutions or approaches that are addressing specific issues that are happening in pediatric children's healthcare. And so we are looking for innovations that are tackling issues or challenges that you have identified or children have identified within those settings. And in terms of the innovations we want to hear about, we want to hear about those that have been piloted or tested, where you've tried it out and you found like, oh, this is working, this isn't working. And we want to understand how that innovation is working. So in case you were wondering, like, oh, could you give us an example of that? What do you mean by innovation? Is there something you can share that you've done before that would qualify as an innovation? I think I saw Lucy here, but like a few 3 years ago or so, we partnered up with Leeds Children's Hospital to pilot VR. And so I would classify that as an innovation. And if I were to apply to this award, and if I was going to seek to win this award, I would define what we did in these ways. First of all, we know that children can be very anxious or distressed or in treatment. Sometimes standard distraction doesn't work, and sometimes you need children to keep still, and some children don't like seeing what's happening in the procedure. And so what happened was there was a consultant at Leeds Children's Hospital that identified that tried VR, thought, oh, this might be really good. And we looked at the literature and we decided to test it out. And we thought this is a good thing for us to test out. But what we were very clear about is that it needed the support of a health play specialist. And so what we did was we had a health play specialist delivering VR to children receiving treatment at Leeds Children's Hospital. And she collected feedback from children and young people. We also collected feedback from staff. And that told us that VR has had a positive impact. It makes children less cognizant of pain. They are happier, less anxious. And it also led to some efficiencies like not needing sedation for some treatments. And that health play specialist plays an integral role in delivering that innovation. And so if I was going to fill in the form, these are the kinds of things that I would include. And we've got an example form filled out with this information for you to see how we would do it. But I would caveat this, that although we did it that way, we know that everyone tries things differently or has different information that you're able to gather. You don't have a Sandy that, lives and breathes research and spends 24/7 thinking about research. And you can ask May with the time of the emails that I sent to her. So it's about you identifying what information can you share with us that can tell us this is how this innovation is working. But this is the problem we were trying to address. This is a solution we came up with that involves health play, and this is how it's working. That's what we're looking for. And I'm going to pass over to my colleagues who can go into further detail.
Thank you, Sandy. Yep, that's me. I'm going to talk a little bit about the sort of application timeline and process. So yeah, next slide, please, Sandy. So as you'll see from this, applications are going to open sort of early January, and that will be publicised on our social media channels, and everyone who has signed up for the webinar today will also receive an email just to remind you that the applications are open. They're going to remain open for about a month. We were mindful of sometimes if you leave things open for too long, it can kind of slip to people's minds or people forget about it. Or if you make that too short, then that could be really challenging for workload and stuff. So we made the call that about a month felt about right. So yeah, they'll be open for about a month, and then throughout February there will be shortlisting and judging, which we'll talk a little bit about in a later slide, and then from March 2025 onwards we will be doing some celebration ceremonies, and again there's a specific slide on that coming up a little bit later. Next slide, please, Sandy. So when you're applying, what are we really looking for? I guess there's a couple of main points to this slide. Sandy talked a little bit about that diagram in the top right-hand corner there. So we do want the innovation to have been delivered at some point in the last 6 years. It doesn't have to have been running for 6 years, but it has to have been delivered to some extent in that 6-year period. And we purposely went back to 2019 because we wanted to do pre-COVID, because we were aware that some things might have just been about to start or had been delivered, but then COVID kind of shut that down and that hasn't been able to be picked up. Or maybe someone came up with an amazing innovation throughout COVID that isn't required in that setting or could be repurposed to different settings. So we kind of thought, let's go pre-COVID. So that's why it's purposely back to 2019. The other two boxes are really about making sure they're true to Starlight's missions. So they have to have used play to address a challenge, an issue, or a gap, and they have to have positively impacted children and young people's healthcare experiences. To anyone who's aware of our Health Play Specialist of the Year awards, I think it's really important to note here that for that process, we ask people to nominate colleagues, whereas for this process, it's actually individuals or teams can apply directly themselves, so you don't have to be nominated. And it will be open to anyone working in healthcare. So we're aware that potentially a nurse or a physio or any number of professionals might have come up with an innovation that's still focused on play, that it doesn't have play in their job title, but we really wanted to capture all healthcare innovations that might be relevant for this award. So we've opened it up to any healthcare professional. Next slide, please, Sandy. So the actual form itself has got kind of 4 key sections. I won't read this out word for word, but essentially the first section is describing the innovation. So what happened, what's the challenge, what's happening essentially. Then there's a section on impact, which is probably the most important section. As I say, it has to positively impact children's healthcare experiences. And we're also really interested in kind of other impacts around has it influenced or changed practice, or has it contributed to efficiency of treatment in some way. And you will be asked to submit evidence of the impact as part of the application form. There is a slide, I think it's the next slide after this one, talks specifically about what evidence we're going to be looking for. And then the other 2 sections are, one is around extra context, so how was it funded, just kind of anything that's helpful for us to know around the innovation. And then last but not least, clearly contact details, and both for the person who's applying, but also what's really important is we want to have contact information for anyone who's responsible for your organisation around communication and media, because we really want to shout about the winners. So it's really important that you seek their kind of consent and they're going to be happy for us to contact them, and then B, give us a way to contact them. So there will be a section on that in the form. I think I'm handing to May now.
Yes, thanks, Kev. So yeah, Kev mentioned for demonstrating your impact, we're going to be asking you to submit some evidence or some data around this to really kind of show that the innovation has had a positive impact on children in healthcare. And the reason we're sort of asking for this is really for you guys to have the opportunity to showcase the work that you've done in that 3rd stage of the model. So thinking about piloting, testing and evaluating your innovation. And as many of you know, like as Starlight, we're an evidence-informed organisation. So we're always trying to gather evidence and data to inform our decisions and think about where's best to put our services. And so in this kind of innovation context, we really want to know, has your innovation had an impact? And do you have some data that you can use to back this up? As Sandy sort of alluded to earlier, we know that everyone will have quite different levels of time or experience that they can kind of dedicate to collecting data. So we don't want that to sort of hold anyone back from applying. So we want to make it as open as possible as to what sort of evidence you could provide to us. So this slide really just demonstrates that, where we've got kind of 5 main categories of evidence that you could look to submit. So just to run quickly through them, the first two bullet points kind of speak to either testimonials or quotes from children or families who you may have worked with when you've been delivering the innovation, or actually testimonials or quotes from your colleagues who may have recognised that impact and kind of can speak to that as well. So in this case, you might be able to provide sort of one or two quotes from these types of people, and that's the sort of thing we'd be looking to see. In the third and fourth bullet point there, we recognise that some teams may have conducted actually their own research or their own evaluation themselves. And you could have collected either kind of qualitative data or quantitative data. So in terms of qualitative, this is things that people are observing or have said themselves. So maybe you've observed the innovation taking place and sort of written down your thoughts about the impact, or maybe you've interviewed a family and can provide some data there. When we're talking about quantitative, we're thinking about numerical data. So perhaps you've got some data from a survey that you've collected, or you've been monitoring children's outcomes. And so you're able to provide sort of a statistic or a number to demonstrate the impact. So for example, perhaps you can say that sort of 95% of children said they felt happy after they experienced your innovation, and that would be completely fine and great to submit. On the final point, some teams may have already produced something that they'd be able to submit. Maybe it's a report, or maybe a PowerPoint, or some sort of output that kind of in a nice little package already demonstrates all of this impact. And so on the application form, you'd be able to upload those sorts of documents as well. It's really important for us to say that we're really happy to receive any or all of these types of evidence. The judges, who we'll talk about later, they won't be looking for one type of evidence in particular, or won't prefer one type over another. They'll really just be looking for, does the evidence demonstrate the impact that you were intending to have, or positive or sort of constructive feedback as well. And as Sandy, I think, mentioned as well, don't worry too much about the volume of data that you can provide. In the example that you'll see with VR, we had the capacity to collect quite a lot of data, but we recognize that not all teams can do that. So the VR example is to give you a flavor of what you could submit, but sort of any sort of volume is fine. Regardless of what you submit in terms of those top 5 points, we'll also, one of the questions on the form will just ask you to provide a short case study, just to explain for a particular child or young person how this innovation has been beneficial. And that just really helps to provide a bit of narrative and bring the story to life for the judges when they're reading the application. And just very quickly about consent, it's just important that you consider that you do have kind of permission or consent from the people that you're speaking to collect this data as part of the application, that you have consent for you to share that data with us. And it's always just good practice to anonymize any names. It just makes the data sharing a little bit safer. Cool. So just a final note on applications. We know that this award is new, and so we want to provide as much guidance and support as we can to potential applicants. So this slide is just to demonstrate kind of the various different avenues that you might be able to seek support from us during the application process, or indeed any time from now, actually. We're really happy to receive questions on the kind of email on the screen. Or you can also ask to speak to us on the phone or a video call to kind of go into a bit more depth about your application. And then we'll also have a couple of resources available on the website. So both this webinar recording, but also some further guidance on the applications, and also being quite transparent about the judging criteria, which again, we'll talk about in a little bit. So we'll have a sort of dedicated space on the website that has some FAQs, which will hopefully provide a bit of guidance if you're got a question during the application process. And as we've spoken about, we'll provide the VR example so that you're able to see the application form in full. So you're able to see how you might answer each question, but also you can see how long the form is. You can kind of gauge whether you want to apply before you actually click through and say apply. So that's it on applications. I think I'm going back to Kev just to talk a little bit about judging.
Yes, thank you, May. Yeah, next slide, please. So, as this slide says, what happens once your application is submitted? First of all, they will be shortlisted by the Starlight team, which will be led by Sandy and May. And then they will go to judging, which will be made up of four. We're going to have 4 judges. So 2 will be Starlight representatives and 2 will be representatives from the health play and innovation sectors. So the 2 Starlight members will be, one will be from our executive leadership team, and we will have one of our trustees with a background in health and innovation. And then, as I say, 2 kind of external members. And together they will, well, first of all, they'll receive them individually. They'll be doing the work as individuals and kind of judging them almost in silos, but then they'll be coming back together as a group to then discuss their findings and cement who they think are going to be the winner, and then there will be 2 runners up as well. Next slide, please, May. So how will applications be scored? This slide might look a little bit daunting, but hopefully we've tried to simplify it as best we can. And what was really important to us when we were putting this process together was that we really wanted the impact of the innovation to be heavily weighted towards. So we really wanted that to be the most important thing. So you'll see here that there's the sort of top 2 sections, or top 2 questions. They both get given a score out of 5, and then the average of that score is taken. So that top section is worth a total of 5 out of 20. And then the second section, which is all about to what extent does the innovation actually have impact, that's given a score effectively of 15. So that is heavily weighted because we're really aware that some people might not be confident writers, or people might not have a huge amount of time, and we didn't really want someone who's written the best application, but maybe the impact isn't as strong, to win over someone where the impact is incredible, but they're just, you know, their skill isn't necessarily in writing the application. So it was really important to us that the actual impact of the innovation was the thing that is scored highest. So yeah, 20 is the maximum score anyone can get. And this is how the judges will be scoring on this basis. Next slide, please, May. That's back to you, I think.
It is, yeah. So to kind of go to the last section of our presentation and end on something positive around how we will celebrate this award once the winner and the runners-up have been chosen. So first of all, representatives from Starlight will visit the winner and the runners-up at their settings to kind of hold some small celebration ceremonies. This is something we've done over the last few years with our Play in Healthcare Week awards, so things like Health Play Specialist of the Year. And it's normally a really nice day to come together and celebrate the winner or the runners-up, and to kind of bring everyone together in that setting to celebrate that innovation. And then also each winner and runner-up will get a prize, yet to be determined, but we're working on it. And then in terms of sharing knowledge, once the winner and the runners-up have been announced and the celebrations have happened, we will aim to host an online event to kind of showcase those winning innovations and hopefully bring in other innovations from the sector as well. And really with the aim of raising awareness of innovation in this sector. And to add to that, we'll be looking to publish a few outputs or reports on our website, which will again help to share knowledge and raise awareness around all of the amazing innovation work that's happening in the health play sector. So I think that's it for the sort of formal presentation. So thanks for sticking with us through that. We've got a good half an hour left. So we'll open the floor out now to questions. I don't know if I've seen any pop up in the chat, but maybe Sandy, you can tell me. Oh, you're shaking your head. Okay, great. So I guess if there's anyone who would like to ask a question, anything that's not been clear in that presentation, this will help feed into our FAQs as well on the website. But anything anyone would like to ask, the floor is open now.
Hi, May.
Hi, Heather.
Can you just clear up? You've said it can come from any professional. So if that's a physio that's using play, does there have to be a play person involved with that initiative?
No, I don't think that's the case. We wanted to make it really open as to who could apply. And as part of the form, we'll kind of ask who's involved, just so we get a picture of who the team is, whether that's a team of physios or it's one physio on their own. But if they did have any contact with health play professionals for the project, it would be great to hear there, but it doesn't have to be, it's not a required thing at all.
Thank you.
Any other questions? Sorry, go on, Sandy.
Yeah, I was just going to ask, was that clear? Do you feel empowered to fill in an application, or is there anything that seems daunting that we could address or change?
No, I feel it's pretty clear. It would be good if we could be sent the presentation. I know it's going to be on the website, but if we could be sent the slides, it means I can take them to team meetings and share it and be able to kind of point bits out. Whereas sometimes if we've got team meetings, we don't have access to a computer or things. So that might be quite helpful certainly for my team, and get the ball rolling with some motivation, perhaps.
Great. Yeah, we can definitely do that. I believe we can upload both the slides and the recording, but those things separately to the website. So it should be on the website, but we can also send it around to people who have attended today or who had signed up. So yeah, we can definitely do that. Cool. Any other questions before we wrap up? As I said, it's insights@starlight.org.uk is the main kind of email address. It's on the slides, and we can send it. If we send around the slides as well, we can just make sure it's in that email. So if you do think of any questions, then please feel free to get in touch at any point. You don't have to wait until applications are open. So if you start thinking about this in the next few weeks or anything, then please just pop us a line. And yeah, if there is anyone in your setting who hasn't come today or was going to come today or whatever, please just share it round. Yeah, we want to get the word out to as many people as possible to try and capture as many great innovations as we can.
May, I'm going to ask the usual question that the Play Champions always ask is, can we get some posters to promote it, perhaps?
That's a great idea. We can take that back to our project group team, and I'm sure we can get something put together and designed and sent out. Yeah, just to raise that awareness in the setting. Yeah, I'll write that down.
I'm actually going to write that down in the chat so that we have a good record of it.
Perfect. And someone asked for the email again. Let me write that in the chat as well. It's insights with an S on the end @starlight.org.uk, and that'll come through to either myself or Sandy, so we can have a look at that. Great. Well, if there's no more questions, we'll let everyone go and have 27 minutes back. But thank you so much for attending today and taking time out to join us. And yeah, any questions, just pop us a line. But have a good rest of your day.
Thank you. Sounds really positive. See you soon. Bye.
Bye.